I wanted to talk to y'all about advocacy, really, like how y'all felt advocacy really is. In the nurse's role, we have a million roles. It seemed like, we do everything. We a jack of all trades. But the one that I think it goes under recognized, it really isn't any space in like hospital settings or in our jobs to act as an advocate, right? And so we talk about it all the time, like how are we advocating for people? We talk about advocating for our patients' rights. And so, but advocacy looks different in the cannabis space, or I think the true definition of advocacy is what you have the possibility of doing in the cannabis space. Most of the policies and procedures are already built for us in healthcare. A lot of the policies and procedures in different roles are already built for us, and we just follow them. You start a job, they give you a bunch of paperwork to sign. Your firstborn is pretty much handed over to be employed at any facility. And then they hold that over your head and they say, if you don't follow these rules, then you have the potential of being fired, which most of the time that's not even true. They can't really fire you without just cause. Otherwise, that goes into a whole rabbit hole of other legal implications. I say that because the way that they build our systems is a fear-based model. And if we don't follow through with that fear-based model, something is taken away. It's like a reward caste system kind of phenomenon going on there. Anyway, in the cannabis industry though, we're at the groundwork. Like this is the bottom, this is the baseline. Like stuff has been done, but everything hasn't been done. So there's opportunities everywhere to put your input into how the scaffolding of the cannabis industry gets built. And it's a really unique experience because it's not like we're changing things, we are building things, we're creating things. We're banding together. And so I think, Tamika, you might remember the conversation about nursing policy versus healthcare policy and understanding the difference between the two. But we didn't really talk about cannabis policy or just like how we build policy or how we build legislation or our role within legislation. And so back in 2020, I was asked to be on a guidelines committee that helped implement cannabis in the schools. And so that was actually the aftermath of the bill being passed. So the bill got passed by a family, Connor Sheffield and his family. Connor is a child who, since he was like 5 or 6 years old, had very severe autoimmune disorder, couldn't eat, had multiple ileostomy. He wasn't able to eat, and essentially he was on the brink of dying. And he tried every modality. This was a rare autoimmune disorder. They didn't have a diagnosis. So the kid, his parents basically said, you know what, we're going to try cannabis as a last resort. That was the only thing that saved his life. Well, now he's halfway to normal. He still has his ileostomy. And he's also going to school now, but he needs his cannabis to maintain an appetite so they don't have to feed him through his peg tube and all that kind of stuff. And so in order for him to maintain an appetite, he had to get his medicine during the day. They had to take him off of school grounds, take him, give him his tincture drops, take him back to school. So highly disruptive to a school day. And so they went through the process of getting this bill passed so he can now get his medicine in school grounds. When you talk to mom is like, I just did what I had to do for my son. For me, it's more like you have literally changed the way that a lot of children have access to medicine and our approach to children who are accessing this medicine in real time. So somebody reached out to me, one of legislators reached out to me through an email that I had sent that was probably some basic ass email. He saved that email, reached out to me, connect me with a lobbyist for the M&A, and then she got me on the committee to help facilitate those guidelines. Cool experience. Definitely referenced on there. Got a lot of pushback. Nobody really wanted me on there because I was advocating for the plant and the patients, as opposed to building these very, like, you know how people be like when you're on these committees and they like, cause the F don't have a line in the middle. You be like, but what they gotta do it just say if. And so we spent a lot of time doing that kind of stuff. And so I would interject where I felt like I needed to interject. But at the end of the day, there was a point in time where I was like, where's the education? how are y'all resourcing this stuff? Like, who is going to be an advocate for the children? Nobody had answers, and they really didn't want to answer. They was there to create guidelines. That's all they was there for, and they made it very clear. And they didn't want to reference me on the guidelines. So they wanted me to create documents. They wanted me to create resources. And then they wanted to take my resources, put them on the document that's going to live in Maryland's Maryland's schools forever, and never say that it was something that I created. And so I dropped off the committee. I said, I'm not coming back. And the next thing I know, I got a lot of people calling me, 2, 3, 4, 5 people calling me, talking about, where you been at? Y'all don't want to reference me. Y'all don't want to acknowledge the work that I have to contribute to this committee. I'm not coming, period. Long story short, they end up referencing me on the guidelines. For me, because it was free work, right? Like, it's not like they were paying me to do anything anyway. For me, I wanted that acknowledgement because it was proof that I was there. That's all I wanted, was proof that I was present.
I know here in Kentucky, I just recently sent all my information to Andy Beshear, since they just did the executive order for Kentucky. The medical patients, they are allowed to get a medical card, but they can't purchase. So there's no dispensaries in Kentucky. So there's nowhere in Kentucky for them to even buy cannabis. So they have to go out of state. They can get a card, but they have to go out of state. You can't go to Ohio because it doesn't recognize the card. They have to go to either Michigan, West Virginia, or any surrounding states that do have either a rec program, and then come back to Kentucky and hope that they don't get pulled over in between. And I've already had a couple patients tell me incidents where, one gentleman, me and him are pretty close. He just got pulled over with his medical card, even though it wasn't all in the scope of practice. He went to court because he was like, look, y'all took my medicine from me, yet and still. And the judge was like, well, I'm still gonna hit you with a disorderly conduct. He was like, I felt that was even worse than getting, a fine for having a possession or something like that, because that sticks on the record. So, when it really comes down to it, it's just the education part. And it's funny that you said that, because we have like a marijuana meetup that's hosted. I've been to a couple, and everybody asks me, well, what I do. And I'm like, well, I'm a patient consultant. And they're like, oh, that's a really good idea. And I'm like, yeah, because there's nobody else doing it. Like, it's just me, other than the bud tenders and stuff that you see randomly, but there's no other third party. So just being able to get out there and just put your feet in the water and let your voice be known around the board definitely helps.
It's like, I feel like there's so much that goes on in the hospitals and in healthcare that, like, now it's just ran like a business. It's not taking care of human beings for their well-being. It's just get them in and get them out and pay the bill.
So even with the scenario with Connor and his family, mom and dad are just regular working people who just know that this worked for their son. That's all they know.
If you find these conversations empowering, then you may want to join us in the Highline Tribe. We are a community of nurses and healers who are seeking alignment. Try the tribe today for a step towards a transformative journey towards wellness and knowledge. See you on the inside.